This is Dr. Khan, Executive Plastic Surgery. So I've done what is a complete end block, initials AG9424. And these are a set of implants from 1992. Silicone, this is when the silicone implants had just been banned. So as you can see, she had what are implants that old. So this is 32-year-old set of implants. And as you can see, just the fact that they're 32, almost 99% chance that they're ruptured. And this is where they were sitting, what is above the muscle. So as you can see, there's inflamed tissue, abnormal tissue, irregular tissue. And just the fact that they're 32 years old, very likely they're ruptured. So it's not only the implant, but the capsule, but the tissue around that's inflamed, irregular, abnormal, because there might be an extra capsular rupture, abnormality, silicone leaching into the periphery. So what I'm going to do is I'm going to go ahead and cut this open. This was done end blocks, and none of the internal contents leaked to the outside. I cut out the excess skin, as you will see, full thickness. This helps with the contouring. This lady is a nice lady in her late 60s. And so as I go in, you will see here I've entered, and as I go in, you will see this is the calcification that is present, and indeed, as anticipated, it is ruptured. And you can see how thin the capsule is. If I go, you can see my scissor underneath, basically all contained, none of this spilled into the chest. Blood loss was like, I would say 3 cc's on each side, so a total of 6. And everything contained. So I'm going to go ahead and invert this open so that now I see like a black mark right here on the inside. Just curious to see what that means. So as I spill this open, you can see this is your 280 cc CUI-DRIE. This is the older generation implant. And you can see indeed it is very much ruptured. And if I put my finger here, you can see my blue glove. And so if I take this ruler, and you can see actually right through number 10, 9, 8, 7. So you can see right through it. I've heard this many times where the capsule is so thin, we could not remove it. That's the incomplete wrong answer. The capsule has to be removed. That's because that's the whole surgery. Now there's some parts of it that are crystallized and hard, as you can see right here, like the scales of a fish that we have seen many times right here. And as you will see, there's inflammation on the periphery. So it's not only this capsule, but the tissue around that has to be removed, because that's where the gel bleed has basically spread to. And again, you will see right here, look at the scales of a fish right here. And you can imagine how hard this was on the chest and in the proximity of the nerves. If I go like this, you will see how hard this tissue is, and you can snap it. So again, not healthy. And this is where these, if in the proximity of a nerve, can cause pain. So this is a ruptured implant. As you can see, none of it spilled into the chest, and they're not meant to be in the body forever. These are, relatively speaking, and again, not safe devices, especially when long term. They do tend to gel bleed. Now I've changed my gloves. We're going to go onto the left side. And again, let me go ahead and show you